Hi, I am so sorry. I did not realize that nobody could view my video. I did it like when it was due and so I can't figure out how to put it on YouTube. I don't know what's going on, but I'm gonna record my own video through my phone and then post that. So I'm really sorry. But here it is.
Hi, my name is Amber, and I have done my presentation on child disintegrative disorder. So yeah, I did my presentation through Prezi, so in a second I'm going to go over to that screen and go through everything. But to give you a little bit of background on what this disorder is, falls under the autism spectrum, and yeah, we'll just dive into it. So bear with me. All right. Okay, so child disintegrative disorder. So first we're going to go into what exactly this disorder is. So again, it falls under the autism spectrum. It's known as a couple different things. I mostly refer to it as CDD throughout the presentation. As you can see, child disintegrative disorder, CDD. It is also known as Heller syndrome, and that is after an Austrian scientist, his last name is Heller, discovered it. And it is mainly characterized by a loss of previously acquired knowledge. So some of these things include like fine and gross motor skills and a couple other things I'll go into in more detail. And this all happens around the age of 4. The final thing is that this disorder is extremely rare. So 1 or 2 in every 100,000 children are diagnosed with this disorder. So part of this made this disorder very difficult to research because it is not as well studied as something like Asperger's or some of the other branches of autism. So I did have quite a bit of difficulty like finding some information on it, but I did find quite a bit of stuff. So yeah, that's basically what it is. Next we're going to go into like the signs and symptoms. So what this looks like. So normally it appears again around the age of 3 or 4. I think the cutoff, I guess, of this would be 10 years old. So there is some variation there, but generally it is between the ages of 3 and 4. So what happens is a kiddo will be kind of growing up normally and hitting these milestones, and then all of a sudden there's a regression of all these previously acquired skills. So it's very sudden. And that is also a reason why it's called disintegration. It's kind of like you're watching these skills deteriorate or disintegrate over time. When it was first discovered, it was also shown as like almost like a form of dementia in children, kind of backwards almost. So yeah, some of the significant losses of skills are anything starting language, so expressive and receptive language skills, social skills, so you can see kiddos that are, communicating very normally with their peers or normally for whoever they are, and then all of a sudden that changes drastically. The ability for these students to care for themselves or self-care, their play skills, because play is such a critical part of development during this time period, and that starts to deteriorate. And then there's also in some extreme cases, a loss of control over bowel movements. And then to go deeper into when and how this happens, it's extremely rapid. So it can be around like a month, but it can also happen in a couple of days. So it's really, really sad. I had such a hard time researching this because these kiddos will just, kind of be growing up normally, and then in a period of a couple days, they start to lose all of these skills. So because it happens so quickly, children are almost aware of what's happening, not why or how, but, it feels normal, not normal. So they have a very large amount of anxiety and terror. So they will have nightmares, waking nightmares, or even like some confusion and jumpiness, overall just kind of terrified. So that's what's going on in those couple of days, weeks, or even a month that this is starting to disintegrate. Let's see. So what you would see as a parent, teacher, or caretaker, It will obviously look different for every individual, but a child will suddenly start to not be able to clearly communicate or have their normal dialogue that they would normally have. The child might not be responding to emotional situations in an appropriate way. And I say appropriate, it's kind of like how they would normally themselves respond to emotional situations. That's starting to change, and they could start to do things in a very repetitive way. So basically just their overall behavior will start to change and regress. And I think it seems as though one of the biggest indicators of this is that loss of language. So that's one of the big ones. So that's what you would see as a parent or teacher. I wanted to look into what goes on with adults during this time period, or, because it's most of the stuff I've seen is what's happening as children, but obviously these little guys grow up. So we're going to talk about CDC as it is in adults. So again, it looks different for everybody. And in some cases, people are able to do things that they would normally be able to do, like dress themselves and eat. Either way, all of these individuals who grow up need constant caretaking and supervision. But I did look up a case study, and this is this young lady, Gina. She's 24 years old, and her case study was very interesting. It was kind of a story about her and her dad and what they were doing. But Gina can dress herself and eat without assistance and can also read books designed for 4th grade. She does a lot of communicating through her iPad and using like text. Didn't really give specifics, but something that helped her in communication and speaking. And she also speaks using 2-word sentences. So what I gathered from this article, as well as from a couple others, is that as you age, you generally don't really acquire any new skills, and you don't really regain any of the skills that were lost after the age of 3 or 4, which kind of contrasted to me with her ability to read books designed for 4th graders. So it seems like you can acquire some new skills, but basically you're kind of stuck in this age where you lost your previously acquired skills. So yeah, that's Gina. But it is interesting to look at people who have CDD growing up and what they go through and how they cope and everything. So that's Gina. That's her right there in the picture as well. So because this falls under the spectrum of autism, I wanted to kind of go into that. It was technically discovered before autism, which is kind of confusing to me, as autism is a very large spectrum. And while it's kind of difficult and tricky to explain. But basically it was kind of its own thing before autism was discovered, and then it was kind of put under autism and is classified as a low functioning disability. It's very different than other forms of autism, but its level of impairment and how it affects social interaction and basically development is very similar to other types of autism. And it is definitely a rare condition. So, but I have a little table down there, and there's a couple of, the different forms, and there is, it's in there, the child disintegrative disorder. So yeah. The last thing I want to touch on is what you would do as an educator if you had a student with CDD. Again, before going into this, I had a hard time finding any case studies of students in an educational setting, and I would imagine these students would need a lot of caretaking and some pretty intense interventions. But I did a little bit of research and found, these are some of the things you can do as an educator to help students with CDD, which is role playing and kind of, definitely doing a lot of that play and modeling. Scheduling a lot of brain breaks throughout the day, which can be anything from movement breaks to drawing or something, whatever that student enjoys. Definitely having a safe and quiet space to work, and part of that reason is to avoid a lot of overstimulation and stress. Computers and iPads for these students, like as we read with Gina's situation, she really, that iPad really helps her with communication, so making sure these students have resources like that. And also a big one is using language that that student is familiar with. Obviously, we would want this to be in their first language, whether it's English or Spanish or whichever, having words that we know this student is familiar with, because as we know, their language is limited. So having a couple of those strong vocabulary words that they're familiar with is really important. And yeah, and there is no cure that we know of for CDD. There are treatments, therapies, and medications, like such as medications that help with seizures, that can help these children cope. But there's really nothing proven that we've found is a solid, help for this. So just helping these students in the ways we can. And that is basically my whole presentation. Here is my resources. I had trouble citing them. I'm sorry they're hideous. But yeah, this, and then obviously our book that I forgot to add. But yeah, that's, let me switch screens here. That is the basics of CDD. I really struggled researching it because it's very sad. I can't imagine being a mom or dad and watching my childhood, develop, very suddenly begin to lose all of these skills they've acquired. So it's pretty intense and it's very sad, and it is very rare. But if you go to YouTube, I'll try to add some of the links. There's a couple parents who talk about what they've gone through and what their child have gone through, children have gone through. So yeah, that's the basics of it though. And thank you for watching.